I think it was the second day after the holiday, this patient came in and it was the same as usual. And something in my mind just went, this is my surgery.
Yeah.
And I'm in control here.
Hmm.
And that was it for me. That was a turning point, because I think I just got fed up of feeling like I was being pushed around in my own surgery.
Yeah.
And I just went, no, that's not happening anymore.
Welcome, guys. My name is Arnold. I'm a dentist in Preston, Lancashire, and today we've got Dr. Sefaakor Ahiaku, and she will be sharing with us the realities of working as a dentist, from graduating and doing the foundation years, working in the hospital, just exploring different areas of dentistry. So thank you for coming on today. We really appreciate you giving up your time.
It's great to be here.
So let's jump straight into it. Were you feeling prepared for the real life of dentistry when you graduated? You know, you had your graduation, you celebrated, and then you started. You know, how was it for you?
I was terrified. I was terrified. I was excited and I was terrified.
Yeah.
And I think for me, the loss of the safety net of our tutors was a big thing. And I'm pretty sure somebody must have said something to me, because I found that in my first few weeks and months, I second guessed myself quite a lot.
Okay.
Because I realized that from now on, every single time that I sign my name on these notes, the buck stops with me.
Yeah.
As to what the decision is. I may have a VT trainer, but actually it's now me making the decisions. And to start off with, I found that quite paralyzing. I couldn't decide anything. I would think I was probably all over the place, here, there, and everywhere. It's like, oh, you could do this, but maybe you could do that. And I kind of felt that I knew what I wanted to say, but I wasn't confident enough to say so in a clear and succinct way. But I guess that in many ways, that's what your VT year is about, finding your feet and your voice.
You qualified from Liverpool. The first year, the foundation year, was it in Liverpool as well? Were you thinking of doing it elsewhere? Because I think your family's in London.
My family are in Wales, actually. They're on
Wales,
Anglesey.
okay. Family's in
Yeah.
Wales.
There was no way I was going to go back to Anglesey. Oh my God.
So yeah, why did you not, go to Wales, or how did you choose where you were doing your family?
Oh, there was no way I was going to. When I left Wales, I was quite excited to be leaving Wales, and I wasn't trying to go back. I'm a city girl, and I like cities. I like the busyness. I like knowing that I have options outside my front door. And growing up on Anglesey, I most definitely did not have options on my front door. So I stayed quite local. I actually worked in Chester and commuted from Liverpool.
Oh, right.
Okay. So got the best of both worlds. And it's not bad. It's like a 38 to 45 minute commute, door to door. And so it worked out quite well. I left my patients in one city, and I drove back to my castle of solace somewhere else.
So how did the year progress? How did you progress as a clinician that year?
So, like I said, I think at the beginning, I kind of think I would split it up in the September to December stretch. And then the January was different, and then post-January. So the September to December stretch, I wasn't very confident. When things needed to be done, I could do them, but I think I found the decision-making process, and especially the signing off my notes, quite difficult. So the first couple of months, I would be at the practice an hour to an hour and a half after everyone else has gone home, and I'll still be there writing my notes, mainly because I couldn't decide what I felt was best. And I couldn't decide, is that caries? Isn't it caries on the bite wings? I second guessed myself a lot. And so I think I spent a lot of time doing admin stuff. I had a brilliant nurse, which was really helpful. She was really, really good and helped me kind of keep a level head, as did my VT trainer. I was blessed to have an incredible VT trainer. And I worked in a practice. We were a 7-surgery practice, and everybody in the practice had specialist interests. So we used to go out on a Thursday for lunch. We had like an extended lunch, and we would go for like a burger at like one of the pub restaurants around the corner, or we'll go somewhere and we'll do something together. And so we had the principal dentist, and we had someone had a specialist interest in ortho, restorative, oral surgery, sedation. And so whatever problem it was that I had somebody who was more expertise than me in that specific area to speak to. And so I think I was really lucky in that sense that I had so many resources in the surgery. So I was at the far end of the practice, and my VT trainer was at the other opposite end. So as you're walking past all the opposite doors, sometimes I'll be like, do you know what, actually, I think I'm going to ask Jason, or I'm going to ask Corinne, or I'm going to ask one of these other dentists, because actually they might be better placed. And they're closer, and they were all very amenable to helping, especially if something was happening and I was freaking out. David's surgery was the nearest surgery. I mean, like, David, please come and help. And he would come in very, very chilled, not stressed about everything. I think once I had a whole crown halfway on, and the kid started crying, and I couldn't get it on and I couldn't get it off. So I panicked. I ran into David's room. He came in, sat in the chair, had a chat with the patient, and I'm sitting there like freaking out, thinking this cement is setting. I'm going to have to drill this crown off. And he just said, "Can I have a little look?" And went, picked it up, put it on the bracket table, and walked away. And I was like, mind blown. He didn't even break a sweat. And so I think seeing clinicians like that was really helpful in me finding my feet. So then over Christmas, I went away for 2 weeks. I went to Ghana as per usual, disappeared, checked out. And I came back, and I think it was maybe my second day back. There was this one particular patient who, if it was like a Tom and Jerry cartoon, they would like run rings around me. They made me feel so stressed. Nothing ever got done. What I planned to do never happened. There were always new problems and complaints. And I think I spent a lot of emotional energy trying to make progress with this patient. And I think it was the second day after the holiday, this patient came in, and it was the same as usual. And something in my mind just went, this is my surgery. Yeah. And I'm in control here. And that was it for me. That was a turning point, because I think I just got fed up of feeling like I was being pushed around in my own surgery. Yeah. And I just went, no, that's not happening anymore. And from that point on, I think things got a lot better and a lot easier for me. Yeah. Because then I was just like, well, actually, no, I am the professional. I do know what I'm talking about. I do have a degree. I have trained very hard. And so I'm going to tell you that I think that this is the best option. And as much as your friend down the street might have had this, I don't think it's a reasonable or practical option. And therefore, I'm not prepared to do that. Yeah. Whereas before the Christmas, there were times where I was sat there, and I guess patients had talked me into doing things that I was like thinking, oh, it could work, it couldn't work. And within like 5 minutes since the treatment, you're thinking, why did I mean, like, I can do it, but why did I agree to do this? After the January, I was just like, no, if I don't think this is a reasonable option, I'm going to tell you it's a theoretical possibility, but I don't think it's reasonable. And I don't think that I'm the best person to provide it. And I think coming into that kind of confidence is really important to be able to be
you speak on that, because in dental school, you'll get told about, reasonable options and when not to go and proceed with a certain treatment plan. But you don't get to practice saying no in dental school, even with patients. You might not be the one that says no. It might be your supervisor who says, yeah, let's not do that. Let's do this. Then you blame the supervisor. Sorry, but supervisor said we're doing this, so this is what we're doing. But we don't actually get the opportunity to practice saying, no, I don't believe in that treatment plan. We're not going to do that. So, yeah. It's good that you mentioned that.
And I think the interesting thing is, I think I had to go through the September to December stretch to get to that point, because you have to a certain extent, you have to do those things that you think, it might work enough times to see that it doesn't work. To then be like, I think there was this one chap who, he'd like snapped off a crown and there wasn't enough space to do a post. And so we attempted to do like a hybrid thing. And I said to him, it might work, it might not. And he was back the next day. So I'm there thinking, I spent an hour and a half of my day yesterday trying to make this work. Am I ever going to do this again? Probably not.
Yeah.
No, I'm not going to do that. But if I hadn't had, I wouldn't call them mistakes, because I don't think at any point my patients were any worse off for me trying those things.
Yeah.
But inevitably, we always ended up doing what I'd felt in my gut we should have done in the first instance. We just went a very long way round and tried all these other things that I probably knew was not going to work.
Yeah.
First.
Part of me says, it's good that you experienced that so that you got a reference point to say, yeah, I'm not even going to waste my time because I just know how that will end up.
And so now what I say to patients is that, yep, some people might do that. My experience is that in my hands, this fails. So if you know somebody who can do this and it works for them, be my guest.
Yeah.
But I know that in my hands, this doesn't work. And so I'm not even gonna waste your time.
Yeah. But, and I think it's a skill. Getting to that point, that's a skill that you have to really develop and get confident in. You're not going to save every single tooth. You're not going to save every single case. You're not going to convince every single patient.
No, definitely not. Definitely not.
Okay,
and I think the other side of it is that, like, some of it is also like picking your patients and being able to read your patients better, because the last thing you want to do is try and do some periodontics on a tooth that's bound to fail, on a patient who doesn't have your best interests at heart and is secretly waiting for you to put a foot wrong.
Yeah.
Because I've been in that situation too, where you think like, oh, actually this complaint's come up, but all I've done is bend over backwards to try and help you. And that wasn't worth it either. In hindsight, I may not have even offered that treatment because it might not have been the best thing for you. But even in this process of me trying to help you, I'm not helped, you're not helped. And so I think there's even a patient component to that as well.
Yeah. So okay, during your first year, foundation year, were there any interests that you developed, or were you just open to all aspects of dentistry?
So I was already really into restorative by the time I got to VT. And when I discovered composite in second year of dental school, that was for me, that was almost my genesis story. Like, I can create beautiful things with composite, and there's art and science and engineering to it. And so I think I actively looked for those opportunities when I was in my VT year. Again, I was really lucky. There was another dentist who was doing a similar master's to me, also in King's at the time. And I got to sit in with him a couple of times. I think we stayed late one night to watch him do a layered composite on a 6 or something, really nerdy dental restorative stuff. And so the kind of restorative and aesthetic side was something that I definitely spent more time looking into, and especially kind of whilst you have the time as a VT, kind of starting to pick up the skills to be able to do things predictably and working out like, oh, okay, well, if you've got a dark tooth and you slam a load of composite on it, that doesn't work because the tooth's still dark and it's still going to look dark afterwards. Okay, so what do you need to do? Okay, maybe I can do this, maybe I can try that. So picking up those kind of restorative and aesthetic skills were definitely the things that I was drawn to. I was already drawn to them before I started, but then being able to make those decisions and see those transformations on my own patients, that was really exciting.
Okay, and how were you, did you have a way of monitoring your progress, or did you have any checkpoints that you were using to know that you're on the right tracks? How did you even know what courses to try and go on?
So I didn't do many courses in my VT year, but one of the things that I did do was take a lot of pictures. And looking at my before and after photos, and then kind of just asking this aesthetic dentist in my practice or other people, why didn't that thing work that way, or why did this turn out that way? And so I think, at least to start off with, I took a much more inquisitive route. I've tried this. Why did this work? Why didn't that work? And now that I've been graduated 7 years. Now 7 years later, to be able to look back on those cases and see that progress over the 7 years, being like, oh, like I would never treat that this way again, or actually, you know what, this does work in some cases, and seeing how my skill has changed it's been really interesting to see.
There's this thing where I think in dentistry, you've got to work to your competence and your in a way that you're confident of working in. But I think you can go the other side of being so safe and never stepping out that you never truly develop as a clinician. I mean, how would you say you handled that?
I think it was a lot easier once I got to a point where I had some confidence. I think when you have confidence in what you can do, it gave me the flexibility to be able to say, like, okay, I can try this, which isn't maybe the way I would normally do something, or the way that I would normally put it together, knowing that if this doesn't work, I still have this as an option here. And so some of the things when I was bringing new techniques into my repertoire, I'll say to patients like, hey, I've been on this course, I've been learning about this, I've done a couple of cases on the course, I think you'd be a good candidate. Are you happy to let me try this? And then giving them a concession on the price. Now, if you do that and then you knock the case out the park, you have a raving fan who will tell everybody within 500 square miles about how good you are. And so I think for me, I was very careful about which patients I try to do those kinds of things on.
Yeah.
I pick them quite carefully. So I think that there are two things that I've done that I think have been really helpful to me along my career. The first thing that I did was to get good at doing the basics. If you can do the basics well, that gives you a good foundation to diversify from. So when I was doing my FD year, I think the thing that stressed me out the most was extractions. And I think quite early on in my VT year, I had a few very bad extraction experience. We've all got them. We've all got the story of that tooth that you're hacking away at for forever and nothing seems to work. Yeah, literally. I think my worst one was, it took me an hour and a half.
Wow.
And again, it was in that September to December stretch. This guy had come in a few weeks before. He needed a lot of treatment. He was sat there sweating in the chair, wouldn't really even let me take x-rays or anything. So we'd taken an OPG and we'd referred him. And he came in and he went, this tooth, I need it out today. And I'm thinking, you must be in pain for you to come in and say that and to want me to provide that treatment today. I didn't really assess the case particularly well. If I had, I would have realized that it was going to be a pig of a tooth, because when I'd been swinging on this tooth for 30 minutes and nothing was happening, and I called my VT trainer and he came and looked at it, he was like, okay, let's see what we can do. And so between the two of us, it took us an hour and a half to get this tooth out. Yeah, in many ways, part of it was bad, like poor case selection. Part of it was bad luck on my part, but we got there in the end, and he then went referred to somewhere else to have sedation for the rest of all of his other treatment. So be aware of what your weaknesses are and be proactive in getting trained in those areas. So for me, I went back to the dental hospital knowing that I would do oral surgery and I'd have oral surgery experience and an opportunity to sit and kind of study again. How do you take out teeth? How do you make it predictable? How do you assess that, being side to side with colleagues? I think learning side to side with colleagues is very different to learning when you're a student. Yeah. You can ask different questions. And so for me, that was really helpful. And then I went on to do my Max Fax job again, because I think probably during my year, my VT year, I would say that taking good impressions and taking teeth out were my two biggest weaknesses. So doing a dental core training job where I was doing restorative, peds, oral surgery, oral med, gave me the opportunity to review my broad base and get good at the basics. So now that, to the point that I now am very, very, very good at taking out teeth. I think since I left my hospital job, there've been maybe 5 teeth in 5 years that I've had to refer, where I've been like, I can't get. Whereas I think if I hadn't had done those jobs and been proactive about getting good at my weaknesses, I think that number would be significantly higher. But I was proactive about that. Yeah. I think sometimes as clinicians, we have a tendency to go, I'm not very good at that, and so I will limit my practice. Now, as much as I don't love oral surgery, I know that I'm good at it, I'm competent, and doing training alongside people who do love oral surgery has given me lots of skills that I can transfer to other bits of my dentistry. Yeah. And at least if it pops up in my appointment book, I'm like, oh, it's a tooth out, but I know I can do it with my eye, well, not with my eyes closed, but with my eyes closed. Yeah. And so so that confidence then gives me being good at that gives me the confidence to do other things. So if there's a place you want to get to, first of all, figure out what your weaknesses are. Get good at your weaknesses. Change your weaknesses into, they don't have to be your strengths, but things that you want to be at least competent and not weak in that area. So change your weaknesses into competencies, and then you can turn your competencies into strengths.
Okay.
So that'd be my first thing. But the second thing that I've done is diversify. Not all knowledge is in dentistry. So again, if people who follow me on social media will know that I connect with mentors, I connect with motivational speakers. There's a guy who I speak to quite frequently called Michael Tabarade. And he is a business and life coach.
Yeah,
and
I know him, actually. We went to the
so
same university.
Nice.
Yes.
So he and I are forever talking about, like, what does growth look like for us? What does growing our business, what does growing our brand look like? What does pushing the edge of things look like? Then going on things like the Ashley Latter course, learning how to be good at communicating, chatting to my financial advisor, understanding pricing, figures, investment. Now, I'm not brilliant at all of these things, but I think the time I've invested in relationships with people who are, again, has helped me build a strength inside me in terms of my character that allows me to do other things. So I know what I want to do. I know where I'm going. I'm confident about speaking about it. So if a patient comes to me and wants a treatment plan to, I don't know, revolutionize their smile, I can pull in on all of those different strands from dentistry and outside of dentistry. Because I think often as dentists, we think dentistry is a bubble, and in some ways it is. But there are lots of people who work outside of our field who have skills and expertise that can become very valuable to us.
That's true.
So I think when I take all of my clinical knowledge and expertise and I combine that with ways of thinking, patterns of talking and communicating and understanding finances, understanding people, and you put those two things together, that puts you in a really good position to grow long term.
So what, in a nutshell, what would you say dentistry is? Would you say dentistry is the clinical? Would you say dentistry is just the people? What would you say dentistry is?
I would say the dentistry is psychology. I mean, I wanted to do psychology. If I hadn't got into dentistry, I think I would have quite happily got onto a psychology type course through clearing. But I think that dentistry is as much about the study and the understanding of people as it is the science. Because I think if you were to put somebody in a phantom headroom for 3 weeks and all they had to learn how to do all day, every day was to drill amalgam cavities, eventually, given enough time, most people would be competent at it. Granted, we all reach competency at different points. Some people pick up a drill and take it, like we all know those people at university, like they do their first veneer prep and you're like, how did you produce this? You don't understand how they're so good. Some people do have a natural flair for it, but I think that a lot of dental skill, in the sense that a lot of it is engineering, it can be taught. We can learn how to pick up those skills. But I think that when I think about how I've put together the service I provide to my patients, I would say that the dentistry that I provide is about 40% of that. And the other 60% is how I relate to them, how I understand them, how I take them along the journey with me. And I would actually rather, which is, I think, guess why Zoom appointments for patients is great, because I will sit and chat to my patients until the cows come home. I can do that on Zoom without wasting chair time. But I think that some of those kind of interpersonal skills and some of those people skills and management skills, managing the people you work with, managing your nurse, managing your patient, their expectations, managing yourself, I think those skills can be a lot harder to come by, especially if you don't have them naturally. Whereas you can be an average dentist who has great interpersonal skills and have a fantastic career. Whereas you can't be an exemplary dentist but have no interpersonal skills. You will get sued and you will get complaints. Yeah, exactly. You can't have the two. And I think when we were interviewing in Liverpool, one of the things that I loved about the system we had is that we had an objective rubrics where we scored the candidates in objective areas, but there was a free text box at the bottom, and it said, based upon what you've seen about this person in this interview, do you think that they have the skills to be a dentist? Because there is that recognition that you cannot measure all of a dentist based on, can they do a filling, can they take a tooth out, can they do a root canal, can they make a great denture? Like, that is part of it, and we have to have those skills. But I don't think it's all of the story. And whenever I looked at that box, what I was thinking is that, looking at this person, do they have compassion? Do they have kindness in them? Do they have a desire to help people? Do they seem to be honest and of integrity? Because actually, we can teach you the dentistry.
Yeah.
That's not hard. Well, it is hard. Teaching you the dentistry is hard, but given enough time, you can do that. But you can't always mitigate for a lack of character and heart. And I think that is really important. And especially when things don't go to plan, having those non-dental clinical skills will be your lifesaver every single time. If you can pick up your phone and say to a patient, hey, like, I realize this didn't go to plan and I suspect you're disappointed because of X, Y, and Z. I want to help you. What can I do? That kind of having the awareness to recognize that something like that is helpful, B, the courage to do it, and then C, the finesse to carry it off in a way that's honest and genuine and bring your patient along with you, completely transforms what could be a really difficult situation.
Yeah, no, I totally agree. And I think after qualifying and graduating and working, I've realized more that it's more about the patient than what you think and what you can do. Once the patient is on board, once you're both seeing things in the same way, once you see the same end goal, then everything else can work. But if you don't see the same end goal, then whatever you do, no matter how perfect it is, you will still have problems. So yeah, I totally agree. Totally agree.
Dentistry is not textbooks.
So I know that you're involved with mentoring. You've got mentors for dentists. So how did that start? What is that all about?
So mentors for dentists, it's a bit of an odd one. So during lockdown, I have been spending a lot of time, well, like everybody, on social media, and I've had a few new followers, some of which were final year students, VTs, and a lot of them were sending me questions and asking me things. And I kind of just realized that there was this level of anxiety in our final years and our FD students, well, FD dentists in particular, because both of those cohorts have lost critical, essentially clinical time at a critical stage in their career. Final years it's going to be a long time since they last saw a patient when they head into their FD year, and similarly, VTs, by the time they head into their first associate job and they're expected to hit like a UDA target.
Yeah, I mean, just even on that, the VTs, because I remember you were saying January was a turning point for you. And for these foundation dentists, they got up to maybe February, March, and then so you're totally right, yeah.
And so, yeah, like I guess I work at two practices, and both of those practices have got FDs, and just kind of seeing them just about getting into their stride and then them being cut off. So I was getting all of these questions together, and I chatted to Christian and Mona, who do M4D with me. And I said, why don't we host a Q&A? Because God knows we've got not that much to do at the moment. And let's just do a Q&A and get people to send us in questions, and we will answer people's queries. Because a lot of the things that we were being asked were naturally things that people would have asked tutors or FD trainers or other associates in the practice, just in terms of your normal working day. And a lot of those opportunities, although they weren't completely gone, were harder to access. So there were things about, how do you pick a practice? How do you pick how many UDAs to do? What courses do we do? I'm concerned and feeling anxious about my first job. How do I manage that? And these are all kinds of things. They're all completely normal things that most dentists have gone through at some point.
Yeah.
And so M4D was kind of born out of a way of like, gosh, I found that transition from FD to from final year to FD, FD to associate. Well, I did FD, DCT1, Max Fax, and then associate. But
Yeah.
I found coming into the associate world again quite overwhelming, even though I've been working quite consistently through those periods of time. So M4D was born out of an idea that, well, hey, actually, those transitions are hard. How can we make it easier? In particular, at this point where things are so different and people's anxiety levels are through the roof at the best of times.
Yeah.
And that has kind of grown over the last couple of months, because we actually have, I think, our oldest clinician graduated in the 1980s.
Okay.
Back up to people who are in their second year of university. So we've connected with over 1,000 dentists and dental students during lockdown across huge breadth, and people sharing their knowledge and their expertise and a willingness to learn together. And like, I think mentorship can be a really hard thing to pin down in dentistry. Everyone says, get a mentor. You're like, great, will you be my mentor? And generally the response is, no, but you should get a mentor. And it's hard to know where to find those.
What is a mentor?
I think a mentor is somebody who is further along the road than you in at least one area.
Okay.
And I think mentors can be across lots of different disciplines. And I think it's important to have mentors and people that you look up to across different disciplines. Yeah. So I have some people and some colleagues who I chat to and I follow who have been graduated for fewer years than me, but they have clinical skills and experience in areas that I don't. Yeah. And so I would do well to listen to them so I can learn something from them. And similarly, I speak to some clinicians who have been graduated many, many, many more years than I have, but they may not have had the same access to some of the aesthetic things that I've had the access to be able to talk to them or I spend a lot of time talking to people about how to talk to people, about how to points across. I think I'm blessed in that something I love to talk. So it's something that I'm naturally quite good at, but then I've also spent a lot of time studying psychology and interpersonal skills. So then they may have clinical experience and I may have non-clinical experience, but we can grow together. They can mentor me in this area and I can mentor them in that area. And so I think it's just about having somebody who is further down the line, and they don't even have to be a million miles down the line. They just need to be further than you are at that point.
That's good. So it was birthed recently. And how do people actually get involved, or how would somebody seek out a mentor from Mentors for Dentists? How does that happen?
So one of the things that I have been putting together, this is like my little baby. And so they're called M4D huddles. Okay. And they're groups that people can join. We've started our first cohort in July, although even though applications are officially closed for this year, we're still getting emails. We're trying to find some more mentors to meet the demand. But at the moment, they're primarily made up of final years who are about to become FDs and FDs who are about to become associates. And so your groups of 5 to 6 with one mentor. And the idea is that you grow together. So it's not a case of you have a mentor and you come to them with every single problem that you've got and they fix it for you and make it go away. It's more to do with, okay, where are your strengths? Where are your weaknesses? How do we grow into that area? So one of the things as a group we looked at this paper called the 5 R's in my huddle. Okay. Earlier on in the month. And it's I'm going to get these wrong, but repair, replace, resurface. I can never remember the other two, but it's a framework for looking at how you how you basically maintain a restoration over its lifetime.
Mm.
And bearing in mind, I've read this paper several times and I've referenced it in assignments for my master's several times, even reading that paper again, like picking up new things, being like, oh, actually, I didn't realize that the two composites I use, like one's one category and one's another category. So if this breaks and I repair with that, that might actually have an impact on my bond strength. So even though I'm the mentor, quote unquote, I'm learning something. And at the end of that, I'm saying, hey, actually, what I need to do is go and look through my drawers and look at my materials again, make sure the things that I'm using tie up together nicely. And if not, I need to change my protocols about how I do things to make sure that my work lasts. So we were looking at that and we ended up chatting about occlusion. And occlusion is something that we could all understand more of. And so one of our next huddles is going to be about occlusion. And so we're going to write down a list of objectives, things that we want to know, and we are all going to go away and do research, and we're going to discuss what we found and learn together. And I fully expect that one of the people in my group will come up with something that I've never seen or never heard before. And actually, that's exactly what it's about. If I can come away and say, actually, I need to go and refresh this, or I need to look in this area, then that's good. So this year, therefore, FD, people about to be FDs and first-time associates. But we're also kind of looking at expanding that out. So having some huddles that are based on specific areas. So like having an oral surgery one, a special care one, a peds one, a restorative one, a business one, a finance one, a communication skills one. And so having some huddles that help people transition in the key points in their career, but then also things that help people keep going long term and keep growing together.
All right.
And aside from, we've got like our webinars. We do webinars. I think this is the first week since May where we've not had a webinar. But
so
yeah,
it's
so like
almost like a study club, but with some additional things that you're doing as a group, and it's continued growing together. Yeah, that sounds really good.
And it's good fun as well. I really enjoyed it.
Okay, just in terms of concluding and rounding off, including the things you've been talking about in your huddles and, talking to people's concerns and fears, what would be some advice you'd give to final years about to go into their foundation year and foundation dentists about to go into the associate world?
Enjoy the break. It might never happen again. So yeah, I think that it's important to invest this time that we have now. And you invest that in two ways. One is by skilling up. So whether that for you is reading papers or watching webinars, skill up, get a feel for the things that you are interested in. There is still a load of free training on lots of things online that is completely accessible. So skill up, make the most of, there's never been so much free
webinar.
Training. Yeah, one of my webinars. But even across the board, you look at some of the stuff that dentinal tubules have done, that dental protection have been running. There is still so much free content, and I don't know about you, but I've never known in my career the ability to get so much knowledge at the click of a button. So invest the time that you have in your knowledge. You might not be able to increase your manual dexterity skills, but your knowledge underpins your skills. So make sure that you understand the basics, but also invest the time in yourself, because trust me, when you start working, you will be really glad for a break like this. Life will get busy again.
Actually, in terms of as rounding off, how do you avoid being consumed by dentistry? Because you can be talking and doing dentistry forever. How do you then pull out and actually balance out your life with other things?
That is a very good question. How do I balance out dentistry? So for me, I work 4 days a week, which helps. I work Monday, Tuesday, Wednesday off. Thursday, Friday, Saturday, Sunday off. And for me, I found that to be a really good rhythm. And on Wednesday, I'll work out, I'll go for a walk, I will make myself poached eggs. I'll do things that are completely different to what I would do on a normal working day. So that's the first thing. But then being involved in other things that you are passionate about. So for me, church is a big thing. Okay. My church community is huge, and especially in lockdown, they've been an absolute lifeline to me. So kind of plugging into other communities that do other things that have nothing to do with dentistry, where you can communicate on a personal level. So that used to be, at one point I used to do Springs Fit, like a trampolining fitness class, and then I did like a kettlebells weight class at one point. I've done dancing, I've done running, I've done lots of different things that plug me into different communities, where my ability to be a dentist 95% of the time in those communities is completely irrelevant and completely superfluous to my interaction. Because so often I know we try to have balanced kind of clinician-patient interactions, but no matter which way you swing it, to a certain extent, there is an imbalance in that relationship, in the sense that you are the clinician and the caregiver, and they are a patient, and they're trusting you, your knowledge, your skills, and your expertise. And so plugging into places where that balance is switched, or even better, where that balance is reversed. Yeah. So today I went and met up with a friend of mine from church. She is, I think, 30 years older than me, so she's double my age. She is wise, she's seen a lot more of life. She's a scientist, but she's not a dentist. And that does my soul really well, because as much as she gets something from me, I look up to her like a big sister. Yeah. She has my back, she looks out for me. And making sure that I'm investing in relationships where I'm not always the responsible person, where actually I can just be side to side with people who are just the same to me, or I can actually be the non-responsible person, helps me out of dental mode. So like things like meeting up with friends like that, I think is really powerful for me, because it reminds me that I'm a human being first, and a dentist.
Awesome. I think that's a really good place to close things. Guys, if you want to find out more about Mentors for Dentists, how can we find out more? Where would we go? The best starting points are at Mentors for Dentists on Instagram. If you can find our Instagram page through the links, you can find pretty much everything. Yeah. We also have a Facebook page. It's a closed Facebook page. You can apply for access to that, and you'll be able to see pretty much all of our webinars that we've done, and you'll be able to watch things back and see what we've been doing as well. So yeah, between Instagram and Facebook, if you can find those two things, you can find out everything you need to know that is to do with Mentors for Dentists. Okay, guys, make sure to check that out. I'll put the links as well in the description. And thank you for your time. We also did a video about getting into dental school and dental school experience, so make sure to check that out as well. Subscribe and turn on the notifications so that you don't miss out on any of the videos, and we'll catch you in the next one. Thank you for coming on. You're most welcome.